You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall. I'm a holistic dentist from Brisbane, Australia, and you're listening to the Dental Zone. Thank you very much for joining me in this episode. I am going to be talking a little bit out of my scope today, so I will be giving some disclaimers. This is going to be informational, and if you need more support, then you must consult with a GP, physician, naturopath, integrative doctor to make sure that you're getting the best advice. I'm going to be talking about Mercury Detox and specifically detox for amalgam removal, seeing as that is part of what holistic dentistry is all about, is helping you reduce the body burden of toxins and things that are going on in your mouth that can be impacting your overall health and well-being. So if you want to know more, you can hop on over to holisticdentistry.au, or you can check out the website for my dental practice, evolvedental.com.au. But until then, let's get started and let's get in the zone. What I'm going to share for you today is solely for information and education. It is not intended as medical advice, and I want you to please consult your physician, a GP, or other health professional if you want to go ahead with a detox and you need more information. So that's the disclaimer for today. So today's episode is about answering some of the questions that you may have about detoxing or countering the effects of heavy metals and particularly mercury from your dental amalgam fillings in this case. So I'm not a toxicologist, I am not a medical doctor, but I am a holistic dentist, and from my own interest, my own research, conversations with other physicians, naturopaths, from years of reading and looking into this, I'm going to share some things that just will open your eyes, will give you a little bit of guidance, allow you to ask the right questions and be empowered when it comes to taking part in your own detox protocol. I've got lots of notes, so I do apologize if you can hear me rustling pages, but I want to make sure I'm giving you the right information. So I'm going to start with the very basics, so you don't have to go back and listen to any other episodes. So we're going to talk a little bit, first of all, about amalgam. So if you think you've got problems with heavy metals, then we must include the conversation about dental amalgam and amalgam poisoning from mercury within the filling material that dentists use. Now, amalgam is a metallic silver colored filling. So if you look inside your mouth and you see metal fillings or dark black fillings, 99.9% likelihood that they are going to be made from a product called amalgam. Now, amalgam is a mixture of mercury, around 50% or so, with copper, tin, silver, and often zinc in it. And now, of that filling material, mercury is by far the most toxic component, but the other metals can contribute to toxicity. Copper is significantly toxic, and tin might cause the immune system to react. Tin is transformed into very toxic organic tin compounds in the environment, and the same process could potentially be taking place in the human body. Silver is toxic to the immune system and extremely toxic to your bacteria. Your intestinal bacteria are daily exposed to large amounts of silver and mercury if you've got amalgam fillings, and this is something that's been shown to induce bacterial resistance to both mercury and antibiotics. Now we're going to look at metabolic detoxification. Now your body has the capacity to detox. It does it every day because we're exposed to toxins within our food and the environment. But when your system starts to get overload, you become toxic, and that can create impairments on your immune system, your microbiology, the metabolism within the cells, and this can start to cause a rise in acidity, inflammation, and poor health. Now, detoxification is the reduction of toxic properties of a substance by chemical changes induced in the body, producing a compound which is less poisonous or more readily eliminated. Your body's natural biochemical processes routinely detoxify many dangerous byproducts of metabolism, that's the digestion and breakdown of your food, as well as foreign substances that enter the body that have no metabolic function. Mercury falls into this category, the no metabolic function one, and is a poison for which no human requirement has yet been identified. In other words, there's no point you having mercury in your body. The liver is the most important organ in removing and eliminating toxic chemicals from the blood. And estimates suggest that about 25% of the Western population, and probably more nowadays with the way that we live, the amount of chemicals that we're exposed to, but about 25% of the populace suffer from some form of heavy metal poisoning. These heavy metals accumulate in the brain, the kidneys, and the immune system. And heavy metal poisoning and poison by other kinds of toxins, they create an overload on your liver. So we're all subjected to mercury. We get exposed to it in our food, the water, and the air supply. If we were not exposed to mercury from any other source than environmentally, then most of us would be able to routinely cope without experiencing any signs or symptoms of mercury toxicity. This is because nature has provided many hidden safeguards. So, example, we're told that if you eat fish, certain types of fish like tuna, that they've got mercury in them. However, what they don't tell you is that these fish also contain a trace mineral called selenium. And selenium helps offset the neurotoxic effects of methyl mercury. So if you eat fish like tuna that's both got methyl mercury and selenium, you're being provided by nature with the product that helps offset and reduce the lethal and neurotoxic effects of methyl mercury compounds. Scientists have demonstrated that fish with higher levels of methyl mercury contain even higher levels of selenium. And then from this, they concluded that the methyl mercury that you ingest in fish is going to be less toxic than methyl mercury ingested under other conditions, like from your fillings, for example. This means that mercury from dietary fish or from your dietary sources is probably not as dangerous as methyl mercury or the mercury vapor inhaled from your dental fillings. Now, if you're not familiar with this, those amalgam fillings release mercury vapor. Every time you clench, chew, grind, eat, brush your teeth, create any sort of friction, any sort of heat on those fillings, so a hot drink, hot meal, just being hot in your mouth, that releases mercury vapor from the fillings at a consistent rate every day while that filling is in your mouth, and you are ingesting that mercury through inhalation. And where's your selenium? Where's your selenium and where's your natural safeguard to offset that? Well, this is what we're coming to with the detox. There is a large segment of our population, about 75% or more, that have a source of mercury implanted in their body. That source of chronic mercury vapor exposure from dental mercury fillings, also called amalgam fillings, is happening if you've got them in your teeth, as I've just explained. So as long as you have silver mercury dental fillings called amalgam, you will be inhaling mercury vapor 24 hours a day, 365 or 366 if it's a leap year, days a year. In fact, the world's leading experts on mercury toxicology have concluded that the release of mercury from dental amalgams is a major contributor to mercury body burden in humans. So what's the importance here about the mercury release from dental amalgam? Well, the evidence indicates that amalgam surfaces release mercury vapor into the mouth. The rate of release is increased by stressing the amalgam surface by chewing, brushing, and heat. The surface layer does not immediately repair after that stressor, and then it takes several hours to completely restore the surface layer. So what we're saying here is that once the filling is stimulated by chewing, brushing, or heat, it starts releasing increased amounts of mercury vapor, and it takes several hours before the release rate is reduced back to the static or unstimulated state. The release of mercury from amalgam results in the deposition of mercury in the body tissues and an increase in urinary excretion of mercury. The estimated release rates from amalgam appear to be consistent with levels of mercury found in autopsy tissues in the general population and with increases in brain and urinary levels due to amalgam fillings. The release of mercury from dental amalgam makes the predominant contribution to human exposure to inorganic mercury, including mercury vapor in the general population. Confirmation of these stats or conclusions that I've given you are also contained in the World Health Organization publication, the World Health Organization Environmental Health Criteria 118, documented title Inorganic Mercury. The criteria says that the average daily intake of total mercury and mercury compounds in the general population not occupationally exposed to mercury comes from their daily intake, and if you looked at it from air, food and fish, it's going to be pretty low. It's going to be no mercury vapor from fish, no mercury vapor from non-fish, no mercury vapor from drinking. From your dental amalgams, you're getting about 3.8 to 21 micrograms of exposure every day. So if we're worried about mercury vapor, then we've got to be looking at dental amalgam. And I just don't think this is really getting the degree of attention that it requires. Yes, more and more people are starting to understand that mercury is toxic, but we're not joining the dots here and going, okay, people have got amalgam fillings in their mouth. That is releasing mercury vapor. That is being deposited in their body, and it is causing health issues. Therefore, should we not be recommending, not just as a dental profession, but medically, that people get rid of their amalgam fillings, and they do so safely with safe protocol that ensure they don't get exposed to more mercury vapor while the fillings are being drilled out? I'll leave you to ponder on that one. When you have mixtures of different metals in your mouth, so you've got amalgam from one manufacturer, amalgam from another, they're going to have different amounts of metals in them. Then you've got metals from platinum and palladium under porcelain layers in crowns, but you also have gold crowns. You could have metal dentures, you could have implants. When we have different metals, particularly gold and amalgam, together in the mouth, this produces electrical currents. And these currents are generated and they increase the release of mercury from the amalgam regardless of whether or not the amalgam is visible. So if it's underneath the crown as what we call a core, then you're placing the gold directly onto the amalgam, and this is releasing mercury vapor whether the amalgam's out in the mouth or not. You can often see a dark discoloration of the tooth and adjacent to the gum tissue. This can indicate a migration of amalgam components into the tooth, jawbone, and gums. If the amalgam filling is in direct contact with gold, it can sometimes evaporate more mercury than all other amalgam fillings together. When gold is placed on top of amalgam, mercury will migrate and the tissues surrounding the tooth will have extremely high levels of mercury. Another aspect of having gold and amalgam present together is that the gold will absorb mercury vapor and eventually be converted to gold amalgam with a much reduced resistance to corrosion, abrasion, and chemical dissolution. It's quite normal for individuals with large numbers of amalgam fillings to develop increasing hypersensitivity to mercury as time goes by. Under these conditions, dental work such as having a gold crown or a metal crown placed on top of amalgam restoration, causing increased release of mercury, can precipitate severe health problems. If you have silver mercury dental fillings and your biochemical individuality, that means what your body can and can't do, and your diet and lifestyle, these are now of much greater importance. These factors provide the rationale of why some people with amalgam fillings cope with the extra daily amount of mercury vapor and their intake of it, and why some people do not. So in other words, depending on how well your body can detox, depending on your diet, your lifestyle, your stress levels, your immune health, your overall health and well-being, this is going to determine how well your body copes with being exposed to mercury vapor or not. It is the do not group, the do not cope very well with mercury, where signs and symptoms of mercury toxicity resulting from an ability to cope with the additional chronic intake of mercury vapor from dental fillings begins to appear. In other words, the body is no longer capable of biochemically detoxifying the added burden of mercury. Scientific research has already demonstrated that mercury, even in small amounts, can damage the brain, the heart, the lungs, the liver, kidneys, thyroid gland, pituitary gland, adrenal glands, blood cells, enzymes and hormones, and suppresses the body's defense system and immune system. In addition, mercury passes the placental membrane in pregnant women and causes permanent damage to the brain of the developing baby. However, these well-researched studies and the well-known effects of mercury seem to be insufficient to cause our dental associations to declare amalgam fillings unsafe. They won't declare it's unsafe until there's specific research demonstrating that it causes a specific disease. Well, I'm going to facepalm and roll my eyes here and go, what? Because what they don't understand here, and this is a complete ignorance of science, is that they do not recognize that mercury does not produce a disease. It produces what's called mercury poisoning. And this is a multi or polysymptomatic issue, and it's easily fit into many different medical diagnoses. So I'm going to give you a brief overview of some of the symptoms of mercury poisoning. Now, brief, I put in inverted commas because even brief is long. So this is not from me. This is from literature contained in textbooks. So to make this kind of appropriate to amalgam dentistry, I'm going to really mark the symptoms that are significant to amalgam poison patients. So I'm going to list them, and I'm going to be very repetitive here. So let's have a look first of all at psychological disturbances: irritability, nervousness, loss of memory, fits of anger, depression, anxiety, insomnia. Very common in mercury amalgam poison patients. You can also get timidity, lack of attention, loss of self-control, lack of self-confidence, decline of intellect, and drowsiness. Let's look at what goes on in your oral cavity, in your mouth. So again, we'll start with the ones for amalgam poisoned: bleeding gums, loosening of teeth, metallic taste, inflammation of the gums, tissue pigmentation. Other things that will happen with mercury toxicity: alveolar bone loss, that's the bone around your teeth getting lost, excessive salivation, foul breath, white patches, mouth inflammation, ulceration, and a burning sensation in the mouth or throat. Gastrointestinal. Again, let's start with amalgam. Constipation or diarrhea, and gastrointestinal problems including chylitis. Then for mercury, abdominal cramps. Systemic effects on the cardiovascular system, first of all: irregular heartbeat, alterations in blood pressure, pain or pressure in the chest. These are all, again, amalgam. Neurological, chronic or frequent headaches, dizziness, ringing in the ears, fine tremors, particularly of the hands, feet, lips, eyelid and tongue. Respiratory, these seem to be more from mercury itself and not from amalgams, but hey, we can't rule it out. Persistent cough, shallow and irregular breathing, emphysema. Immunological conditions, very, very common with patients with amalgam: allergies. You can also flare up asthma, rhinitis, which is inflammation of the nose, sinusitis, and swelling of the lymph nodes, particularly in the neck. Endocrine issues, this is your hormones. Cold, clammy skin, especially of the hands and feet. You can get subnormal temperature and excessive sweating. Others, muscular weakness and speech disorders, more so with mercury toxicity. From amalgam poison patients, dim or double vision, fatigue. Fatigue is very common. Joint pain, also very common. In severe cases of mercury exposure, patients will have hallucinations and manic depression. In those with amalgam poison, I've already gone through what is significant, but let's now look at the exposure to organic mercury. Now, the earliest symptoms are fatigue, headache, forgetfulness, inability to concentrate, apathy, depression, outbursts of anger, and decline of intellect. Later findings: numbness and tingling of hands, feet, and lips, muscle weakness, dim or restricted vision, hearing difficulty, speech disorders, loss of memory, incoordination, emotional instability, dermatitis, kidney damage, and general central nervous system dysfunctions. It's a big list, and that's the brief list. And that list comes from evaluation of people who had suffered from chronic or acute industrial exposure or ecological exposure to mercury vapor. The study of micromercurism, which is a low-level exposure, has been very limited in scientific literature. And this is what you get from amalgam. You get consistent low-level exposure. However, there is significant evidence from symptom surveys of amalgam poison patients that suggests that continual exposure to small doses of mercury over longer periods of time can produce many of the symptoms that I have just listed. After all, it's the same biochemical pathways in the human physiology that are affected by larger doses of mercury that result in clinical observational symptoms. Now, these are also affected by low continuous mercury exposure regardless of the source. Inorganic mercury in some body tissues, such as the brain, has a half-life of 25 years. This means that it takes 25 years for your body to get rid of half of a single dose. Given this fact, it's only going to be a matter of time and degree of exposure until some form of symptoms appear. Unfortunately, mercury is so toxic to the human body that there can be cell death or irreversible chemical damage long before you get clinically observable symptoms that indicate that something is wrong. You could be experiencing some of the symptoms that you get from the mercury release from dental amalgam fillings, but because the mercury exposure is so gradual, and because the time between the placement of the filling and the onset of symptoms can vary so dramatically from weeks to years based on your own biochemical makeup and sensitivity, it may not be readily apparent or identifiable that it's associated with your dental mercury amalgam. So it's not like you get a filling placed and the very next day you're unwell. And then that happens in so many cases that we can go, let's join the dots. Everyone who gets an amalgam filling gets sick. No, what happens is it's a slow drip feed and your symptoms may appear 10, 15, 20, 30 years later. And then you're being told that, that's a part of aging, or that's this issue or that issue. And it becomes very difficult for your physician, for your doctor, to relate what they're seeing and what you're presenting with subclinical symptoms of mercury toxicity. It's not new. It's not new what I'm telling you, because in 1926, there was a German chemist who said, dentists are not in a position to recognize the general effects of amalgam fillings or even learn about them. Patients suffering from nervousness, intellectual exhaustion, etc., usually don't go and complain to their dentist that they don't feel well. They will rather discuss their problems with their physician, a neurologist, or a laryngologist, etc., a specialist, rather than say to their dentist, hey, I don't feel very well. It's really difficult to diagnose what's going on. You come to me as a dentist and I see that you've got gum disease or periodontal disease, which is the later stages where there's destruction of gum health and the bone around the teeth. And I'm not going to be straight away as a generally trained dentist going, I think this patient's got mercury poisoning. No, I'm going to go, you've got bacteria, you've got plaque, you've got tartar, you've got a rough filling edge there, you've got food impaction, and I'm going to treat you traditionally for gum disease. But if you look at the scientific literature and the textbooks for mercury and amalgam fillings, it pathologically damages the periodontal tissues. That's your bone, the ligaments, membranes, connective tissue, and all the cells that make up your gums and the support structures for your teeth. So do you not think if our patients are presenting with gum disease that doesn't particularly respond well to treatment and they've got dental amalgams in their mouth, we should be speaking to them about the impacts of mercury toxicity? Yes, we should. But the problem is 99.9% of dentists don't understand or know about this link. There are very, very few dentists and gum specialists called periodontists that recognize that mercury from dental amalgam is one of the causative factors for development of gum disease. Okay. So now I've given you my brief synopsis so you don't have to go back and watch or listen to every single episode of Dental Zone. What are you going to do about your mercury? You might be sitting there going, oh, for goodness sake, Rachel, I'm terrified now. You've told me I've got mercury. I know I've got fillings. I've got some of those symptoms. I don't generally feel very well. Well, what can I do about it? What can I do about it? What can I do to minimize the effects of chronic mercury exposure? Now, if you are asking those questions of a toxicologist, their first recommendation and their first course of action would be to eliminate the source of exposure. So number one, you've got to stop being exposed to mercury. And number two, the second course of action is to therapeutically attempt to reduce the body burden of mercury. Essentially, stop being exposed, do a detox. So in this situation, you're going to be addressing the source of mercury, so that has to be eliminated. So for me and you, if you've got dental amalgam, for me, I would be recommending, for you, you would be considering having the elimination of mercury coming from your silver mercury dental fillings. Now, the only way you can do that is to remove them from your teeth. Now, sadly, for a lot of people, this is not financially possible. And it means that they're left in a situation where they can't remove their amalgams, or sadly, they seek the advice of their general, traditionally trained dentist who has limited understanding and has been told that mercury contained within your fillings is perfectly safe and it doesn't leak out. They're going to tell you not to worry about it. It's not a problem. You're overreacting. And the fillings look fine. They're still filling your teeth. They look absolutely fine and they're doing their job, so don't get them replaced. That is ignorance. It is ignorance of the fact of toxicology, and that the first thing we would be recommending is eliminating the source of toxins. So therefore, your amalgam should be replaced. But I don't want you to let your general dentist just do it, and some of them will go, oh, okay, then that's what you want to do. I'll do it for you. I'll change them over. I'll swap them out for white ones, because they want to help you and they think they're doing the right thing. And, I can make some money by doing this treatment. Yet what they're going to do is they're going to drill away on those fillings, create heat and friction, and release tons of mercury vapor, tons of mercury particulate and dust, which you will inhale and be exposed to. You will swallow and ingest, and they're going to do you more harm than good. So please make sure you find a well-trained holistic dentist who is smart, certified. That means they're going to follow safe mercury amalgam removal technique and ensure your safety as well as their own. Okay, so if you can't find a mercury safe dentist, and if you can't afford to get your amalgams replaced, then is there anything that you can do to help yourself without having your amalgams replaced? Well, the answer is yes, and it's also no. Let me explain why. It's a yes because you can help to mitigate and offset some of the effects of having mercury in your body. The problem is you are still going to be exposed to it. So this is something you've got to do consistently until you can get some of those amalgams taken out. Now, even if you could only afford to have one done every year or a couple done every year, that's a big step in the right direction. So, we need to overcome the destructive metabolic and toxic effects of mercury. It is irrational to assume that the source does not have to be eliminated for there to be some relief or improvement in health. The average human being takes at least 17,000 breaths of air per day. If you have silver mercury amalgam fillings, this means that you're inhaling 17,000 microdoses of mercury vapor each day. It takes the body about 30 to 70 days to get rid of a half of a single dose of mercury vapor exposure. That's a long time when you're still being exposed to it. Okay, I'm just rustling my papers. Sorry, let me stop there. This is what I was going on to say. This means as long as you have a source of mercury vapor implanted in your teeth, your body will continue to very slowly accumulate mercury, adding to the total of your body burden of this insidious poisoning. Now, there are different approaches available for helping you to reduce your body burden of mercury. There are drugs on the market that have a great affinity for mercury, and that's going to help to reduce the body burdens. This same can be said for supplements and food. And there are homeopathic remedies, but I'm not so sure about those. And they have to be administered under the supervision of your physician or a licensed health professional. But there is a way you can attend to it yourself, and this is through nutrition. It's an easily available self-help way of you being able to reduce the impacts of mercury on your system. So let's look at supplements. Now, supplements don't act like medications, which rapidly can take away symptoms without doing anything to the underlying cause. Supplements are actually intended to correct deficiencies and to enhance your resistance to harmful influences. If you are healthy, not exposed to toxic compounds, and eat a very varied diet, you've got no immediate need for supplements, but your performance is likely to be enhanced by moderate doses. Unfortunately, though, the case is that everyone is exposed to metals and other toxic substances and stress. The ideal situation does not really exist. Then everyone has a unique metabolism, and some may need more of one particular supplement than another. Modern farming, food manufacturing, cooking, and these sort of things, they change the food. They lead to oxidation and loss of vitamins and trace elements. In processed food, some of these, but not all, are added back again. Now, there are recommended intakes of vitamins based on levels which prevent deficiency diseases. These levels do not indicate what you should take to give you optimum health. Therefore, there's like a base level that will stop you being deficient in iron or vitamin C or zinc or B12, for example. But that level is not what you need to have optimum health. So you may need more, is what I'm saying. If there is a load of toxic substances in your body, you are going to burn up and utilize more of the protective substances, and therefore you're going to need more each day. Now, your requirements are going to be conditional, depending on what you're exposed to, your lifestyle, and your genetic factors, for example. Even for a professional nutritionist, it's going to be very difficult or almost impossible to figure out what to eat to get the optimum intakes of every vitamin and mineral on a daily basis. And this is why I think supplements are the way to go. I take supplements myself, and I do talk to my patients about taking supplements. And again, I can only give loose guidance, and I recommend that you seek the support of a good naturopath or physician or healthcare provider. There are many, many excellent studies detailing how mercury disrupts biochemical pathways and can cause nutritional deficiencies. They can be quite technical and difficult for the layperson, and even myself sometimes, to fully understand. Now, attempting to reverse the process of mercury exposure by supplementing with nutrients being most affected by mercury appears to be the most common sense and simplest and most effective ways of reducing some of the chronic effects of mercury exposure. Many of the nutrients have the ability to bind with mercury, lead, and arsenic, which would then tend to help your body excrete these toxic metals and thereby reduce your body burden. Sorry, let me stop. No, hang on, let's go again. Your body burden. I've included lead and arsenic here because they're also universally available in the air that we breathe and in our food chain, and affects many of the same biological and biochemical pathways as mercury. There's been a lot of animal research that has demonstrated that when lead and mercury are both present, there is a synergistic effect. That means they intensify their total toxic effect. The presence of heavy metals in the body can cause and enhance the generation of free radicals. Free radicals are produced by chemical reactions in the cells, and more scientific research indicates that free radicals play an essential part in compromising the immune system and in the development of various diseases. Although the human body has its own defense system against free radicals, certain supplements called antioxidants augment our natural defense mechanisms and assist in coping with unspecific oxidation caused by free radicals. Antioxidant therapy is not quackery or alternative medicine or health food faddism. It is the frontier of biomedicine. Antioxidants are most effective as preventive medicines, but they're less effective when problems have already developed, but that doesn't mean they don't have their place and that they won't be of benefit. There are many manufacturers around the world that have recognized the necessity of providing products that will assist in reducing body burdens of heavy metals, environmental pollutants, and they are making antioxidant formulas to help our own defense and to combat free radicals. Most health food stores throughout the countries carry some of these products, and you can use them to help reduce your body burdens, and the people in those health food stores are usually able to advise you of the manufacturer's technical information, how it's been tested, and the scientific literature and formulation of the product. There are some other aspects of nutritional supplementation that can be of great significance in the efficacy of their use. This means, you've got to look at your particular brand, you've got to look how it's been tested, you've got to look at how bioavailable and how easily absorbed those things are, because if you swallow it and it doesn't dissolve down very well and it's not going to be assimilated into your body, then there's no point taking it. I would prefer you don't take it in tablet form. I like a powdered form because it means it's already dissolved, and then as you drink it, it gets ingested into your system very easily. Tablets, if they don't break down, they just get passed through. They don't dissolve, and you don't get what you needed to be absorbed. And you're going to have very little benefit to your detox program. So if you suspect that your supplements aren't dissolving properly, then swap to a powdered or liquid form. There's a simple test that you can do yourself to see whether your supplement does dissolve well. Place your tablet in a glass of lukewarm water with a little bit of vinegar. Without touching the tablet, just swirl the water to stir it up at short intervals. If the tablet dissolves in less than an hour, that means it's going to be okay. If it takes more than an hour, it's going to be a very little nutritional benefit, and it may actually cause irritation to your digestive tract. Another problem with supplements is, should you take them on an empty stomach? Should you take them before meals, after meals, with your meal? By definition, the word supplement means to supply a deficiency. Therefore, the basic concern is how to get the most benefit from a supplement to correct a deficiency. The assimilation of the nutrients is facilitated by taking them before your meal, so that the full effect of your stomach acids can start the digestion process without it being diluted by food. Others are fat-soluble vitamins, which means that they require some fat and fat-digesting enzymes in order for the body to handle them properly. So these fat-soluble nutrients are best taken after your meal. Others, such as amino acids and acidophilus, are best taken on an empty stomach, so they do not compete with the amino acids in food and have the food detract from their full effect. There are supplements that you should take, and I will try and include the appropriate and most effective time for consumption when I go on to talk about them. Otherwise, it just gets really confusing and you're just going to find it too hard and too difficult to stick to. Again, my information on supplements is not intended as medical advice. It is information that I'm bringing together to help you have a better understanding, and your effort to improve your nutritional status should ideally happen under the direction of a qualified doctor or healthcare professional. This is especially true if you're allergic to a variety of substances. So if you're going to self-experiment, I advise you do so with caution. As a general caution, when you're embarking on your nutritional supplement program, don't be in a hurry. Don't do what I used to do and go, oh, that says 1 drop a day, building up gradually. Oh, I'll just start at the high dose. No, it's not a good thing to do. I can tell you from personal experience, it makes you feel worse. Your body's got a very delicate balance mechanism. And unless you're very well read and understand nutrition and supplementation, and you're presently supplementing, then I would say proceed very slowly, give your body a chance to adjust, and take it step by step as you add in new nutrients and new supplements. To support you with your detox program, your supplementation and nutritional program, then it's a good idea to do a self-evaluation. The addition of some of the key nutrients affected by mercury and lead may produce some beneficial health effects through the reduction of symptoms related to existing health problems. This is anecdotal and it's not going to constitute scientific proof that mercury from your mercury silver dental fillings is the culprit. It does suggest that you're on the right track if you self-monitor. You can put yourself on a simple program that you may wish to initially try for a period of 4 to 6 weeks. And I'm going to cover that in the next episode, because otherwise you're going to have a bit of information fatigue and overwhelm by this point. Well, we're nearly like 50 minutes in, and I want you to come back with a fresh approach, pen and paper at hand, or your notepad, whatever you're going to type into. And I'm going to recommend or suggest some things that you can do for 4 to 6 weeks. Don't leave it all to your memory. And I want you to start a self-evaluation diary, beginning with a list of all the symptoms that you have, followed by your actual supplementation program. Then you record your reactions on the program daily. If you feel better and have an abatement of symptoms, it may be indicative of a possible correlation to your silver mercury dental fillings. Individuals with mercury silver fillings, this is just a little side note, don't have any chewing gum. Stop chewing gum because you're releasing more mercury, and the chewing forces will stimulate the release of mercury from the fillings and additionally substantially add to your body burden of mercury. So that's a real simple thing you can stop doing immediately. So some of the supplements that we're going to talk about as part of this 4 to 6 week program, just so you can kind of get yourself mentally prepared, is glutathione, vitamin B6, which is called pyridoxine. I don't know how to say half these names, so do forgive me. Vitamin B1, silmarin, zinc, vitamin C, and selenium. So this has been basically kind of an overview and an introduction as to there are things you can do if you still have dental amalgams in your teeth. There are things you can do if you can't find a qualified, smart, holistic dentist to remove them, or if you just are not financially in a position right now to start getting amalgam removal done, or you can only afford to have 1 or 2 fillings replaced at a time, which means you've still got fillings in your mouth. So yes, there are things you can do. There are supplements you can take. There are nutritional foods that you can add. You can make changes to your diet and your lifestyle. One of the biggest things that I recommend first off with all my patients is they increase their intake of water. So many people are chronically dehydrated and they go, well, I drink tea, I drink coffee, I'm getting fluids. And yes, whilst you may be getting fluids, those things have a diuretic effect, which means you pee out more fluid from your body and you become more and more long-term dehydrated. So I want you to start by adding more clean water to your daily intake. Aim to at least every day drink 1 or 2 more glasses of water than you normally would, and then gradually build that up. Because if you drink more water, it's going to help your digestion, it's going to help your kidneys and your liver, and it's going to help you to be in a position to start flushing toxins from your body and absorbing your nutrients and supplements more effectively when we start the supplement 4 to 6 week self-evaluation regime. So I'm Dr. Rachel Hall. I'm a holistic dentist from Brisbane, Australia. You've been listening to The Dental Zone. We've been starting to broach the big subject of dental mercury detoxification. I hope you've found this useful and enjoyable, and that you will join me for the next episode so we can get into the meat and gravy, the nuts and bolts, and the specifics of detox. Again, I'm not providing you medical advice, and I recommend that you seek the support of a physician and a healthcare professional to work alongside of you during your detox program. If you want to know more, then hop on over to holisticdentistry.au. You'll find all my other podcasts there. I also have a YouTube channel under my practice name called Evolve Dental. You can also reach out to me there if you'd like to book in to get your amalgam fillings removed. And you can call us on 0737201811. Thank you so much for joining me. I'm Dr. Rachel Hall. This is The Dental Zone. This is the podcast where I support you to understand what's going on in your mouth and how that impacts on your health and wellness. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.